For this video, we're going to talk about the pelvic girdle, and the pelvic girdle has three different types of bones, and you see most of them here in this picture that you see in front of you. On distal to the pelvic girdle, there's the right portion of the pelvic girdle here. There's the posterior portion of the pelvic girdle and the left portion. Distal to those, you have the femur on the left-hand side and the femur on the right-hand side, and I've removed those for this source of discussion. The girdle itself is actually talked about in a different way here. So the entire structure is the pelvic girdle. There is the right os coxae and the left os coxae, and os coxae is spelled O-S-C-O-X-A-E. Those are lateral. Posterior to them is the sacrum and the ilium, and those are, the sacrum and the coccyx bone, and those are portions of the vertebral column that you've already seen about. One of the os coxae is actually three bones that have been entirely fused. There are three bones: the ilium, the ischium, and the pubis. If you hear the words "put your hands on your hips," then that means, and you would be touching this area right here, that is the ilium. The ilium is superior. There's a fossa, a gentle depression right here called the iliac fossa, and then there's a prominence right here called the iliac crest. So the iliac fossa is this gentle depression, and this crest right here is the iliac crest. Inferior and posterior to this is the ischium. The ischium is the lower portion of this hole right here. And then medial to this portion here is the pubis. So the three bones here, then we have the ilium, the ischium, and the pubis. I'm going to rotate this view for you a second. Here's another way of looking at it. The ilium, the ischium, the pubis. Three bones meet at this significant depression here. The depression is called the acetabulum. This is the point where the point of articulation between the ilium, the ischium, and the pubis, and the left femur. There's a very large foramen that you can see that I made here. This foramen right here, this very, very large hole, is called the obturator foramen. The ilium right here, I'm going to talk about the ilium as being the superior portion. They meet at the acetabulum. The inferior to the acetabulum, you have the ischium. The ischium goes down here, and it's the ramus of the acetabulum. The ramus of the acetabulum is inferior to the obturator foramen. Now, the ramus of the ischium is inferior to the obturator foramen. The pubis bone, the pubic bone, has two rami or ramuses. This is the main portion of the pubis. There's the superior ramus of the pubis and the inferior ramus of the pubis. The inferior ramus of the pubis fuses with the ischium. The combination of these rami makes the obturator foramen. Medial on this whole thing is the pubic symphysis. Another thing that you should recognize here is that the angle here, this angle that I'm tracing with the left os coxae up to the point of the pubic symphysis, down to the right of the os coxae, the angle there can allow you to understand if the skeleton is a male or female. When the skeleton's a female, you have a very large, very wide-angled arch. This is the pubic arch that we're talking about. And when I say wide angle, I mean greater than 90 degrees. When the arch or the angle is less than 90 degrees, so very, very sharp, then that's a male. The obvious implication of this is that a wide-angled arch allows for the birth process to occur safely, and so females have that characteristic.